The health center is now the primary delivery of healthcare in the city of Lynn. The city of Lynn is about 95,000 people. In March, we essentially went from around 6,000 visits a week to under 1,000. So we were having essentially no revenue coming in for about 3 weeks. I fully expected us to essentially deliver services until we ran out of money and then we would close.
For some reason, if the community health center had to close down, I don't know exactly what I would do, because I do get all of my services here. I get my primary care, I get my behavioral health service, I get my optometry.
In March and April, I had a grid on my wall, a sticky note grid. And the sticky note grid kept track of any donation that we were receiving. There was a graph on the other side that marked how many days of us being open that money represented.
I have to stick close by to this health center in order to maintain my general well-being.
So one thing that we wanted to do was to continue to provide care for our patients, but also protect our patients and also protect our employees. So we pivoted to telehealth. So within 3 weeks, we were able to go from 10 telehealth visits a day to around 1,200. But that pivot would not have been possible without the help of our partners.
The health center is actually helping to keep me safe by doing these face-to-face telemedical calls.
When Martin Luther King was talking about the beloved community, I feel that I have a beloved community in my institution, in my city. Ironically, the pandemic has reinforced that sense. We got so much support from our community. It was this revelation that not only do we love what we do, but other people appreciate us for the work that we do and for the love that we show. For the first time in our existence, we actually have a wait list for behavioral health. The demand for behavioral health skyrocketed. It's about 3 times higher than what we're used to seeing, particularly for kids, which we didn't quite expect.
It's important that they are open and they are here, because if not, I don't know really what I would do.
When people don't have power, when people don't have education, when people don't have money, it's easy for the system to not address their needs. And so our job is to figure out, how do we find people whose needs are not being addressed? Who is currently suffering the most, and how do we address their pain?
Essex County nonprofits do incredible work to care for our most vulnerable communities. But as the pandemic wears on, many are challenged to meet the growing need with limited resources. You can support their critical efforts by making a donation today. Donate at www.eccf.org/give.